Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and MediSpa. Welcome to Ask Anonymous, where patients write in some questions for me to answer. So hopefully if you're tuning in, some of the questions are some of the ones that you might be thinking of, and we'll get underway.
Which is better to do first, a deep chemical peel or a mini lift to the face?
It's a good question. First of all, I'm not really much into a deep chemical peel. I think lasers are better and safer. I think you have more control with a laser. So again, with that or a mini lift, it's kind of, my philosophy is it would be better to get your skin in the best shape. So I usually recommend undergoing a laser treatment prior to the facelift or neck lift. In this case, if you're going to have the chemical peel, that's fine, but I usually would recommend to do that first, but it's not a problem if you want to do it the other way and go with the surgical procedure first. So it really is what works out best for you, but my feeling is get your skin in the best shape it can and then undergo the procedure.
Okay, you have two questions here, actually three, regarding rhinoplasties. Are you a rhinoplasty expert? One about breaking their nose, or deviated septums.
Mm-hmm. So I don't do any type of nasal surgery anymore. It's been a number of years now. So when I have patients or people that inquire about rhinoplasties, I send them to, there's a local ear, nose, and throat surgeon here in town, Dr. Grant Gilman, who's phenomenal. He's a terrific surgeon, great bedside manner. So I refer all of my rhinoplasty surgeries to him, and my patients have been extremely happy with their results and with his care.
What type of procedure is best for helping to reduce my crow's feet?
Crow's feet can be a couple of different reasons. So when people look at crow's feet, it's lines on the side of the eye or the orbit here. Now, the upper crow's feet, if they're above the corner of your eye, a lot of times that can be because as we age, the brow might be coming down. And so basically a brow lift would help correct that. If the crow's feet are below the corner of the eye in this area or get worse when you smile, then neurotoxins are a better choice in that scenario.
I am considering an arm lift for loose skin due to aging, not weight loss.
Mm-hmm.
Can you explain how the incision is placed, how wide the scars are, and what your procedure is to minimize scarring?
Another great question. So no matter how you have excess skin, whether it's with weight loss or just normal aging pattern genetics, there's a couple of ways of doing a brachioplasty or an arm lift. The way I do it is I put the incision just on the lower part of the upper arm. There are some of my colleagues who will put it in the middle of the arm or behind the arm. I don't like either of those too much. When I put it on the lower part of the arm, when you have your arm down, it's hidden. When you have the incision on the back of the arm, you get a good contour, but when you have your arms down, people can see the scar. When you put the incision in the middle of the arm, then you have to stop at the armpit, and you don't want to cut through the armpit, and that can have problems with healing. So I put it just below the mid-level of the upper arm. It gives a great contour. Now, as far as scarring, what I warn every patient, this scar in the upper arm stays pinker longer than any incision on the body. So where most incisions are fading anywhere from 3 to 6 months, this might be 6 to 8 months. So just know that. And the other thing is that skin is thin, so there can be certain areas where that scar can actually get a little bit wide. What we're planning on is a very fine line starting from just above the elbow all the way to the back of the armpit. And that's usually how it heals, but you can have segments of it where it might become a little bit thickened. Many times once it's healed after about 6 months, you can actually do some scar revisions in the office under some local anesthesia and tidy that scar up a little bit. So for me, the scar regimen is multiple layer closure at the time of surgery, and then we watch that scar at every time that you come in for your post-op. We start massage at about 5 to 6 weeks after surgery. And we use Silogen silicone sheets for scarring if it's needed, and we don't start that till about, usually again, around 5 to 6 weeks after surgery.
Are there any remedies for sagging jowls other than surgery?
There are, well, depending upon how bad the scarring is, or I'm sorry, the sagging is, sometimes we can do non-invasive or minimally invasive corrections such as microneedling and radiofrequency, and that can help tighten that area. Sometimes one of our Helix laser treatments can help tighten that skin a little bit, and that's a CO2 and a 1570 nanometer laser together in the same beam, and that can tighten it a little bit. But surgery is the definitive way of correcting it. And again, it just depends on what your goals are. If you just have a little bit of jowling starting to bother you and you want to try the minimally invasive, they work well. But again, it really depends on how much you want it corrected.
I would like to get a tummy tuck. How long is recovery time and how much is it?
So recovery time after tummy tuck, it's an outpatient surgery. Surgery takes a couple of hours on most people. No exercise for 3 weeks. Depending upon your job can be anywhere from being off 2 weeks for most people, anywhere from 2 to 3 weeks. But if you have a very physical job, I have UPS drivers, FedEx drivers, things like that, where you are lifting a lot for your job, it might be up to 6 weeks off, between 4 and 6 weeks. So it really depends on your job. As far as how much it would cost, I would have you talk to my patient care coordinator at the time of your consultation, because sometimes you'll need a little bit of liposuction of your hips. Sometimes you think you need a tummy tuck, and maybe a liposuction of the abdominal wall might be better. So again, Tony would have that information.
I'm wondering why my surgical scars from a mastectomy and reconstruction and tummy tuck are still itchy 5 years later. The itch is deep and seems to be worse in the evening when I finally remove my bra. Is this common so far out?
That's a hard one to answer without seeing you. Sometimes when it's 5 years out, the scars are pretty mature at that point, and a lot of times that should be gone by then. You may have some thickened scars that are still deep in the tissue itself. It might be amenable to some Kenalog injection, which is a non-inflammatory steroid. So I'd have to see it. My recommendation would be to go back to your surgeon and talk to them about it, because there might be some things that they can do. Again, microneedling radiofrequency might help break up that scar tissue as well, and that's just under some topical numbing cream. So there might be some things you can do without ever having to go back to surgery.
I had a breast lift 2 years ago. Am I still a candidate for augmentation? If not, how long should I wait?
2 years is plenty of time. Most of the time, if we do a staged breast lift and then an augmentation after that, most of the time we wait about 6 to 8 months. So you're beyond that. So at some point, if you want to talk about see a plastic surgeon about an augmentation, you're fine to do it at this point. Well, thank you for your questions. I hope that I answered them with enough information for you. But listen, feel free to write into us, info@bellissimoplasticsurgery.com, or on social media. And at the next installment of Ask Anonymous, I would be happy to answer your questions.